orientation. So let's start our timer. So here we go. We were finishing up last week. We just finished up talking about the x-rays, and then we're talking about reported findings, your vertebral subluxation complex score. And that's one of the things that we do at Back to Life Chiropractic is we grade your subluxation, which we talked about on like the videos before this, what subluxation is. And so, but it's kind of nice because you can see as you're getting care if you're improving. And then one of your goals is to decrease and get rid of the subluxations in your spine so your body's functioning healthy. And so, you know, that just keeps a nice running. That just shows, it keeps a nice running, you know, score of how if you should be getting better. Because in the beginning, you know, you're in chiropractic, you're always having to get adjusted a little bit more. That's one of the concerns about a lot of people is like, do I have to come here forever? But eventually, you know, you don't have to. And then, you know, it all depends on what's your health score. So one of the things that we work on is your lifestyle changes, because we talked about that in the other videos about with the new patient orientation, about that you have to make lifestyle changes, especially in these 7 areas that we found that will help you hold your adjustments and not have to get adjusted all the time. So nutritional, cardiovascular, flexibility, strength, posture, nervous system, autonomic nervous system, and feet and arches. So these are all things that if you would get in the wellness category, then you would be in prevention and wellness. So, and that's another score sheet that is a Back to Life Chiropractic score sheet. So report findings. So your vertebral subluxation complex and lifestyle recommendations, nutritional, cardiovascular, strength, flexibility, posture, nervous system, and arches are all things that we're working on Back to Life Chiropractic. And so what you're going to find out at your report findings is where you are on this chart, how long it's going to take you to get out of your acute care, your rehab care, and then what you might have to do in prevention. And so, you know, and then you're going to get that score through vertebral subluxation score, but then you're going to get a lifestyle score on what different things that, you know, are you in wellness or in your crisis. So it's kind of nice because then you can see what you need to work on. And then we actually have Back to Life system, you know, which is another workshop series, the cheat sheet that actually works on all these things. So it's a nice system. The whole Back to Life system is very nice because you got a score sheet that you know where you need to work in which categories, how you're doing, and then, you know, and then what you're maintaining. And then you actually have a cheat sheet that actually helps, and a checklist that helps you improve in each area. So it makes, and then eventually, you know, you're going to get a habit. And so that's one of the things you'll see in all our other workshops is that we're trying to create a habit. So it's not something that you're going to have to like painstakingly check all the time, but eventually you'll just be in the wellness. It's much easier to stay in wellness than it is to get out of illness. So with the new patient orientation, we have different chiropractic techniques. A lot of people don't realize when they go to the chiropractor that there's more than one technique that a chiropractor can use. But here at Back to Life Chiropractic, we do diversified, Thompson, motion palpation Gonstead, Logan activator, applied kinesiology, SOT, biophysics, Schofield techniques, Nimmo, Cox, Palmer, and diversified too. So these are all the different techniques that we use. So a lot of people don't realize that, you know, some people, you know, might do better with diversified adjustments, more manual adjustments, where somebody else might need some more low force techniques where they don't have to get adjusted or moved or twisted or lay on their back or have their necks done. But they can have the Logan technique, which is a low force technique. And then activator is a low force technique, and then Gonstead's a technique where you work within the autonomic nervous system trying to balance it out. And Thompson's a low force technique. We can move things around. And then usually most patients get a combination of this. And then we just figure out what works best for you. So to review, secret number 1, sick care is not health care. You must know the difference. So we talked about that in the earlier videos. Pain is, although unpleasant to experience, is a necessary biological process for survival, not just the fact that something has changed. So pain is not necessarily a bad thing. It's your body communicating So you either need to do something different and make some changes. And then secret number 3 is the nervous system is the master system of our body, controlling all perceptions and functions. We live our lives through our nervous system. So secret number 4, vertebral subluxations are a sign of interference to the nervous system and are a primary focus of chiropractors. They can disturb the function of various symptoms of the body, reduce health status, and uncorrected can lead to a serious decline in health. And secret number 5, lifestyle stresses in 3 dimensions, physiological, biochemical, and psychological, causes negative effects on your nervous system and cause vertebral subluxations. So there we go. We're going to have to stop because our 5 minutes is up, but we'll continue on. We're almost done there at the end. So